I'm a curious creature in many ways, not least being some kind of criminologist working in public health. But I would just reiterate a lot of what other people have already said. So when Mark Moody said, or paraphrasing now, the fear of the other, in other words, are our service users seen as citizens with rights in a public health perspective, or are they people to be feared? And one of the observations, some of you might have seen an article from the ex-chief executive of the NTA, Paul Hayes, not that long ago. If you Google Paul Hayes Home Office, you'll take you to an article where Paul basically argued strongly that the Home Office is indeed the right place for drug and alcohol treatment, because the associated crime with addiction is it brings funding into a much sharper focus. And I just cut and pasted a bit from Paul's article where he said drug policy and drug treatment has never been a priority for the Department of Health or the NHS. The financial crisis, the interface between health and social care, waiting times, cancer, dementia, and a host of other issues dominate the Department of Health and the NHS agenda. And even when policy is focused on the wider social determinants of health in an effort to reduce the burden on scarce NHS resources, the priorities remain smoking, 80,000 deaths a year, obesity, 30,000 deaths a year, obesity, if you speak to colleagues from the NHS, obesity unchallenged, unaddressed, as they probably bankrupt the NHS quicker than anything, basically. If you haven't been to a male surgical ward in the northwest of England, or indeed in Greater Manchester, I'm not suggesting, God forbid, that you do, but my father-in-law has been in Oldham, not quite regularly, to have an abscess packed on his leg. I'm thick-skinned, I've seen most things. I was absolutely mortified by the number of men having legs cut off because of type 2 diabetes. Frightening, I mean absolutely terrifying. So when you set against that, then you see that the challenge that we have. Nevertheless, on the positive, so if you look at the history of the investment in our sector, our industry, when I came in, in the 1980s, so early 1980s, the entire system operated on less than £18 million. The entire system. About 2010-11, you could argue it reached the high watermark of £1 billion. So from walking around pubs in Ancoats with a collecting tin for Lifeline to £1 billion, and obviously that £1 billion is reducing now. But from a public health perspective, I'm ever the optimist. On the fifth wave of public health, as Michaela said, that's where I'm at. I'm really quite optimistic, because what the fifth wave of public health says, in essence, and I'm grossly paraphrasing the arguments now, is that the solution lies in the community. Yeah, ultimately, funding notwithstanding, long-term recovery lives in the community. So it basically, and what we need to do as treatment services is, whenever people come to us and get comfy and want to spend the next 25 years with us, we actually say, a bit like Lenny Bruce always used to say, the comedian, what's the only advice you can give to somebody going to the electric chair? Don't sit down. Yeah? Almost, not saying to make it as uncomfortable as that into treatment services, but always reminding people that long-term recovery lives in the community, and the fifth wave of public health is fundamentally relational. It's about us as people. Some of us are professionals, some are not. But about us as people saying, don't look to me for the long-term solution. Look to that meeting of Alcoholics Anonymous, that meeting of Narcotics Anonymous, that meeting of Smart Recovery, that meeting of ACT, Acceptance and Commitment Therapy in peer groups, faith-based groups, Weight Watchers, Slimming World, there's any number of mutual aid. That's where recovery lives. And so from a public health perspective, in the fifth wave, I'm quite positive, but obviously the challenge is, which I'll talk about in my bit afterwards, who's coming into that bit, about austerity, not to be underestimated.